skeletal traction and skeletal pin in place. What would be the nurse instruct the unlicensed assistive personnel to report immediately? What is the meaning of this question? Patient with a fracture of fibula is receiving skeletal tractions. What is traction? Important. Yes, anyone? What is traction? Yes. Yes, please. What is traction?
അത് സപ്പോർട്ട് ചെയ്യുന്ന ഒരു ഫ്രാക്ചർ ഉണ്ടാകുമ്പോൾ നമ്മൾ സപ്പോർട്ട് ചെയ്യാൻ വേണ്ടിയിട്ട് ചെയ്യുന്ന ഒരു
Anything else? It is just given to support. Okay, any other answers? What is traction? Why? What is the indication? Why really it is important?
പ്രോപ്പർ അലൈൻമെന്റിന് വേണ്ടിയിട്ടാണ്.
Yeah. Normally, traction, it is a pulling force applied into fractured bone. Usually that is done to realign the bone. Traction, which is applied to a fractured bone to realign the bone. മനസ്സിലായോ? ബോണിനെ realign ചെയ്യാൻ വേണ്ടി കൊടുക്കുന്നതാണ് traction. There are two kinds of tractions. What are those? There are two kinds of traction. One is skeletal traction and skin traction. Traction can be directly applied to the bone. It is considered a skeletal traction. So in skeletal traction, we may need to insert some screws, pins, rods. Fine. So by using screw pin wire, the traction or the weight is applied to the directly to the bone is considered as skeletal traction, whereas in skin traction, it is not an invasive procedure where the traction is applied to external to the body. So what is traction? It is pulling force which is applied to realign the bone. Fine. There are two kinds of traction, skeletal traction and skin traction. Example of skin traction, like a pelvic traction, Russell's traction. Traction usually applied to the lower extremities. It's called as bus traction. All these are considered as skin traction. How do we identify skin traction? Because in skin traction, only by using crepe bandage, you apply like a stability in the leg, and then traction is applied to that. So it is not an invasive procedure where the traction is applied to the skin, and with that pressure, it will give pressure to the bone which is inside. That's skeletal traction. Sorry, skin traction. Skeletal traction, traction is directly inserted into bone. Okay. Fine. So what would be the nurse instruct the unlicensed assistive personnel to report immediately? So one of the following is indicating some problem or some concerned thing that has to be informed. അതായത് ഇതിനകത്ത് ഒന്ന് നമുക്ക് കൺസേൺഡ് ആവേണ്ട കാര്യമാണ്. ഒന്ന് നോക്കാം. Patient want to change position in bed. Is that normal or abnormal? Yes. The normal ആണോ? With the traction, patient can change position. It is a normal thing. There is a small amount of clear fluid at the pin side. Do you think it is normal?
Yes.
Yes. Small amount of fluid, that is quite normal. But if you feel like heavy, like a large amount of fluid, that might be indicating some other kind of oozing. So it can indicate infection. So you have to be very cautious. Third is the traction weights are resting on floor. Majority you selected that. What is wrong in that, or what is the problem in that?
It is always the floor touch ചെയ്യാൻ പാടില്ല.
Okay, the weight should be always away from the floor. Okay, so when you apply weight to the patient's body, it has to be always away from the floor. Never touch the floor. Okay, so that is the wrong here. And the patient report pain and muscle spasm. Pain and muscle spasm is quite normal in traction. Okay. Commonly, when the patient is not mobilizing extremities, the muscles get spasmatic, or spasm of the muscles are common when you not doing any activities, or when you are not using your muscles. Fine. So the better answer for this is the traction weight are resting on the floor. Okay. Okay, fine. And then it also knows, I want you all to learn what is skeletal traction, what are the types of traction, and why do we, or how do we insert skeletal traction? By using skeletal pins and screws, or some supportive items, which is fixing the weight to the bone, directly to the bone. So it is an invasive procedure, so it can cause infection. Second one, there is a small amount of clear fluid is not indicating infection, but cloudy fluid or any kind of ball smelling fluid, that everything is will indicate signs of infection. Yeah. Okay, fine. In evaluating the appropriateness of various exercise employed by a patient with osteoporosis, the nurse should recommend what exercise you would give for a client with osteoporosis.
Okay.
The better exercise for osteoporosis is
Walking.
Yeah, walking. What is osteoporosis? Osteoporosis.
Thickening of the bones.
ഒന്നുകൂടി പറഞ്ഞടാ.
Won't become weak.
Thinning of
Thinning of, not thickening. It's like a thinning of, perfect. Thinning of the bone. Exactly. So look at the picture. It is there. The first picture, this is the normal structure of the bone. But in second picture, bone with osteoporosis. So what happened? There are number of holes formed within the bone. Osteo, bone. Porosis, poro, pores. Holes in the bone. Okay. Tell me what are the causes for osteoporosis, Vijay? Causes. Osteoporosis in the karanam.
Calcium deficiency.
calcium deficit.
Deficiency of calcium and vitamin D.
Okay, any other causes?
menopause, ma'am.
Okay. Then what else?
Smoking affected you.
Smoking, yeah, smoking can cause, menopause can cause, then old age. Okay. What else? Hormonal, like any hormonal replacement. Fine. So these everything can cause the problem. Yes, fine. Next. Nurse is caring for a patient who had dual energy X-ray absorptiometry scan and he is now prescribed calcium with vitamin D twice a day. And the patient asked the nurse the purpose of this drug. What drug? Calcium with vitamin D. What is the nurse's best response? Select all that apply. What is the best response of the patient? Patient is prescribed with calcium and vitamin D twice. Patient asks the nurse the purpose of the drugs, why it is important, why calcium and vitamin D is important. What is the nurse's best response? Okay, we'll see one. When your calcium and vitamin D level are low, your risk for osteoporosis and osteomalacia is increased. Is that? Do you want that?
Yes.
Yes.
Okay. Second, when your vitamin D level is high, your bone release calcium to keep your blood calcium level in the normal range. What is the action of vitamin D? First of all, tell me what is vitamin D? Is vitamin D? Yes. Vitamin D in the
Fat soluble vitamin.
it's a fat soluble vitamin. Okay. From where do we get vitamin D?
Sunlight.
Sunlight, some food.
Yeah. Yeah, so we get from food as well as we get from sunlight. Natural source of vitamin D is sunlight. Okay, so why it is important? What is the function of vitamin D?
Help absorb
Mm.
calcium.
Can you repeat it? It is not really clear. The sound is, your sound is not clear.
It helpful for the absorption of calcium.
Okay, it is helpful for the absorption of calcium,
Calcium.
right? Yes, exactly. So vitamin D, usually when we get vitamin D from natural sunlight, so it get absorbed through where vitamin D enter into our body through. Yes, from where do we, or we get vitamin D from sunlight and it get usually absorbed through dash.
Skin, tissue.
This exactly, it is through the skin. So usually vitamin D get absorbed through skin. Okay. So yes, so through the skin, vitamin D usually gets absorbed. Then vitamin D will remain in our body. And then what happens? Kidney will stimulate the vitamin D. Okay, kidney will stimulate vitamin D, and this vitamin D helps to stimulate one hormone, that is parathormone. What is parathormone? Yes. What is parathormone? What is parathormone? It is a hormone by parathyroid gland. Okay, this is a hormone by parathyroid gland. Fine. What is parathyroid gland? It is a gland found in the thyroid gland. There are 4 parathyroid glands. So parathyroid gland produces parathormone, and this parathormone is usually helping to absorb calcium and phosphorus. So parathormone is helping to balance calcium as well as phosphorus. Okay. Usually calcium get absorbed from the food from the intestine. From the small intestine, calcium get absorbed. Fine. Calcium get absorbed into the blood. So basically when it reaches into the blood, the parathormone will help to stabilize the calcium level by replacing the calcium into the bone. That is how the bone get mineralized. I repeat, we get vitamin D from sunlight through the skin. Once it enter into skin, it is not enough normal effective situation. So when it is absorbed through the skin, kidney will stimulate the vitamin D, and when it gets stimulated with the kidney, it gets stimulate the parathormone, or it usually stimulate parathormone. It is a hormone by parathyroid gland. Parathormone is usually necessary for the absorption of calcium and stabilization of phosphorus. Okay, remember calcium and phosphorus always in the opposite direction. Calcium gets absorbed from the intestine, and when it reaches into the blood, calcium has different function, not only single function. Calcium has different function. Calcium is usually mineralizing the bone. It is helping us as a neurotransmitter sometimes. Okay, it balances the intercellular and extracellular pressure. So it has various functions. Usually when we talk about calcium, we normally think that it mineralizes the bone. Fine. So that is the foremost and important function of calcium. Okay. So calcium will be taken from the intestine and it will reach us in the blood, and from blood it will be stored in the bone. That is how the bone get mineralized. And phosphorus is also necessary along with the calcium. And phosphorus is usually stabilizing the calcium molecule to bind together. Fine. So when calcium gets absorbed more, the phosphorus absorption will reduce. And that is controlled by parathormone. Okay. And what the second option says, when your vitamin D level is high, your bone releases calcium to keep your blood calcium level in the normal range. Normally, vitamin D level when it is high, vitamin D stimulate the parathormone. Definitely the second thing will happen. Your bone releases calcium to keep your blood level. No. See, when your vitamin D level is high, the bone releases calcium. Up to this is okay. But that is not usually done to keep your blood calcium level in the normal range. Manslayo, here the half is okay and half is not okay. Yes? Are you following?
Yes, ma'am.
Okay. So second one, I will not select as answer. Why? Even if half answer is wrong, we can't select that as correct. Right. Third, when your blood calcium is low, calcium is released from your bone, increasing your risk for fracture. Do you want that?
Yes.
So, yeah. We'll select that. What is the meaning of this? Calcium level is low, calcium will be released from your bone. That will help to increase the risk of
Risk of
fractures, that
fracture.
increases pathological. Next. Next is when blood calcium is normal, long bone are formed by increasing person's height. Is that?
No.
No, this is not. Yeah. The extra calcium and vitamin D will protect your bone from damage such as fracture.
Yes.
This can be selected. You can also get the extra vitamin D by increasing your intake of beef and pork source. Yes.
No, I think.
It is wrong. Why?
Yeah. That is.
Yes. So what are the vitamin D rich food?
Egg yolk,
Egg yolk. Fish and fish liver oil, all kind of cheese products
Milk.
sometimes, but calcium is found high in dairy products, but still. And the egg yolk, all small kind of like even the beef liver is having
Beef liver.
vitamin E. Beef liver, not beef. Beef is having iron more. Fine. And mushroom has
Mushroom.
vitamin E. Yeah. And like fortified foods, like the preservative added, like the already stored food. Fine. So those kind of food is having high amount of vitamin D. Okay, fine. Anyway, mushroom is having rich of vitamin D. So what are the answer? See here, 1 we selected, 3rd we selected, and 5th we selected. So I want everyone to learn what is vitamin D. From where do we get vitamin? Okay, and what is parathormone? It is produced by which hormone, which gland? What is the function of parathormone? Okay, by understanding this, can I ask you a question? If you get a patient who is, who is a victim of a burn injury, he is just he has his contractures as well as he had an extensive deep thickened burn almost 70% in the body, and the patient is recovered, everything is okay now, the patient is completely all right, but the skin texture is not okay. So my question is, later years when it passed, what deficiency, chronic deficiency will happen for this particular patient? Extensive burn, more than 50%. Even not more than 50%, even a 20-30% will also can cause a long-term complication. Yes. The answer is there in the writing.
Vitamin D.
Hmm? Yes.
Calcium and vitamin D deficiency.
Deficiency of vitamin D. Because the skin is not proper, so those damaged skin is not able to absorb the vitamin D, and we get vitamin D through our skin so that our exposed skin area will absorb the vitamin D, not every skin. Fine. So what
Ma'am,
about
അത് ക്യൂർ ആയാലും അബ്സോർബ്
the skin damage ആവില്ലടാ, സ്കിന്നിന്റെ ടെക്സ്ചർ ഡാമേജ് ആയി പോവല്ലേ, so it is not able to absorb. Fine. So extensive burn can cause later complication as vitamin D deficiency. Okay. Okay, fine. Next. The nurse is preparing a patient who had carpal tunnel release surgery for discharge. Which information is important to provide for this patient? The nurse is preparing a patient who had carpal tunnel release surgery and patient is getting discharged. Which information is important to provide? What is carpal tunnel release surgery? It is a choice of treatment for carpal tunnel syndrome. So tell me, what is carpal tunnel syndrome?
Numbness and tingling up.
Numbness and tingling of the extremities. It is because of what?
No problem.
The exact reason? No reason.
Neurological disorder.
Okay.
Medial nerve damage.
എന്താണ്?
Compression of carpal tunnel. Medial nerve damage.
Median nerve damage. Okay, more than that we can remember. The median nerve get compressed. Look at the picture. See, when the median nerve that is giving sensation or that is usually maintaining proper sensation of all the entire fingers. മനസ്സിലായോ? അപ്പൊ ഈ ഏരിയ ഉണ്ടല്ലോ, ഈ മീഡിയൻ നെർവിന്റെ ഈ പോർഷൻ, ഈ മീഡിയൻ നെർവിൽ കിട്ടുന്ന ഒരു കംപ്രഷൻ. സോ ഇറ്റ് ഈസ് കാർപ്പൽ ടണൽ സിൻഡ്രോം. It is a common condition. Okay, and in that, as Suru said, numbness and tingling sensations will be there. Along with that, what is the basic reason behind this? Median nerve gets squeezed or else the median nerve gets compressed. Okay, so that is the reason why it developed carpal tunnel syndrome. Now tell me, what can be the reason for carpal tunnel syndrome? Yes, എന്തായിരിക്കും reason എന്തായിരിക്കും medial nerve compressed ആവാൻ? Yes.
DM.
Okay. Anything else?
Knee injury.
Injury, yes, perfectly all right. Yes, injury.
Hormonal problem.
No, it's dear simple compression of the nerve. Hormonal problem is not going to compress any nerve. You see, you don't use the entire theory knowledge. You only use your common sense. Then you will get. Look at the area where the median nerve is situated.
Pituitary gland damage or some imbalance.
നിങ്ങൾ പഠിച്ചിട്ട് എന്നെ വേറെ ട്രാക്കിലേക്ക് കൊണ്ടുപോവാ. Okay, note that. And a simple reason, Anna. Very simple reason.
Arthritis, ma'am.
Arthritis, yes, that is, yes, perfectly. Arthritis can cause it because basically in a rheumatoid arthritis, there may be chances to get a what is that? Twitching of the muscles or shifting of joints. So it can definitely compress. Any other? See, simple thing. It's correct.
Same without any mobility.
Yeah, it's like some kind of mobility problems or repetitive hand use. And just imagine when you continuously using mouse, computer mouse.
Yeah, wrist joint problem.
Wrist joint problem. Like when we use continuously, when you use the mouse, computer mouse, it can damage. Okay. So these are the certain reasons for developing compartment syndrome. That is something really important. When a person who is working in an information technology team, IT team, and he is complaining like numbness and tingling sensation in the extremities. So you can just remember the reason could be because of the mouse which has been used. So you can't tell him like you resign your job and go for another job. No, that is not really safe. But you can use like a comfortable mouse pads, or else some intermittent use of intermittently, you have to release the pressure. Those kind of exercise can be given. Okay, basically it is expected in case of a repetitive hand use or moving of hands, like a vigorous moving of hands, it can happen. And then hand and wrist problems, any kind of hand and wrist problems. Even sometimes medical conditions like only rheumatoid arthritis can happen or can cause, it can cause joint shift and that compress the nerve. So how do we manage? Like upper tunnel release surgery is the surgical correction that is usually performed. Okay, and that is not a question. What is the question here? Question ഇവിടെ ചോദിച്ചിരിക്കുന്നത് എന്താണ്? ഇവിടെ എന്താ നമ്മുടെ അടുത്ത് question ചോദിച്ചിരിക്കുന്നത്? Which information is important? ഇതിനെ കുറിച്ച് പറയുമ്പോൾ എന്ത് information ആണ് കൊടുക്കേണ്ടത്? ഒന്ന്, the surgical procedure is a cure for carpal tunnel syndrome. Is that? So you can drop your answers so that I can see. Let me check. Second. Okay. Do not lift any heavy object. Everyone is supporting second. So why is first one is wrong? Why do you find this first one is wrong? Yes.
നമ്മൾക്ക് പറയാൻ പറ്റത്തില്ലല്ലോ ക്യൂർ ആവുന്ന പേഷ്യന്റിനോട് സർജിക്കൽ പ്രൊസീജിയർ.
Okay, perfectly all right. Okay. Which information is important to provide? Okay, so you are not responsible to give these kind of statements. Okay, fine. Okay. Why fourth one is wrong?
ഇത് സാധാരണ സർജറി കഴിയുമ്പോൾ കുറച്ച് സ്റ്റേജ് അങ്ങനെ ഉണ്ടാവില്ലേ?
Okay, after surgery, like a pain and discomfort is expected for at least for a shorter while. Okay, so here the patient is getting discharged. So the priority thing, see, always remember which information is important to provide. That means all these four information are important. മനസ്സിലായി? ഇത് തെറ്റെന്ന് നമ്മൾ പറഞ്ഞിട്ടില്ല. ഈ 4 ഇൻഫർമേഷനും ശരിയാണ്. We have to explain, but one of the following information is important to provide. That is a difference. മനസ്സിലായോ? So at this particular moment, like after surgery, when the patient is getting discharged, അങ്ങനെയുള്ള സമയത്ത് first നമ്മൾ പറയുന്നത്, what is the most important that the patient has to follow? Never ever try to lift any object. Basically, if this has happened for females, okay, I am just imagining my side. If I get this problem, definitely after procedure, normally when we come back to home, usually as for females, they are like tend to do activities when they see something, or usually we tend to have a number of activities at home. So we have to give importance on this. Never lift any of object with that hand, because that gives more pressure and it can again further damage. Fine. So that is the reason why second answer. Only the as per the time period or as per the time situation, second one is not good, but rest everything, first, third and fourth is also really necessary, but it can be explained later. Okay.